Hi, this is Maureen O'Hara. I'm picking up with the Tuesday bundle. I just finished with the heart and lung note. Here's the pre-op order set that we have. If you can get this on the chart before 5 o'clock, that way we might be more successful in getting the fragment stopped. They have a 2-hour window, and I believe it's scheduled to be given at 6 o'clock. So if you get it on much later than that, it may not be stopped. So we want everyone to be NPO after midnight. We want them to hold the insulin dose in the morning, unless obviously they're not diabetic and they're not on insulin. We want the antibiotics to be sent to 217 so that the antibiotics can be given over there by anesthesia. Stop the fragment. Anesthesia has requested that we order PT-PTTs on transmets and above. And if they've got low H&H, you may want to repeat a CBC. And then check off this draw today. Um, I think this is an old form. On the new form, it says draw today for stat in the morning so that it will be ready for us by 6 o'clock. We want to type and screen anybody who is Charcot surgery, transmet and above, or an H&H that's less than 10 and 30, which is pretty much all of our patients. And then we want the pregnancy test on any women ages 15 to 55. And the nurses are good about taking it off. You can cross this out and put ASAP and they'll do it. For the dialysis patients, we want to get some post-dialysis labs, and the anesthesiologists are not too picky about how many hours after dialysis it is. So sometimes the dialysis nurses get a little picky about that, but anesthesia is not. And then here's my note to you. To be sure to document the heart and lung exam on Tuesday. Be sure to get the blood consent with the surgical consent. Everybody gets a blood consent. Give the patients the blood transfusion brochure if you remember to do that. Anesthesia requests that you do not write for any fluids overnight. We've had people get fluid overloaded, and especially if potassium is added, we've had potassiums go out of whack. They also request that people get PT-PTT in the morning for transmet and above, and type and screen for transmet and above. Charcot surgeries, which are very bloody, and anyone with an H&H less than 10 and 30. And be sure to get a pregnancy test on all women. Date, time, sign, put your number. Be sure this should have the patient identification information on it already, and put that on the chart. So that's all for Tuesday. On Wednesday morning, you're going to have these post-op day 0 orders, and I think I'm going to stop here and I'll pick up with that in my next segment.